Hi, thank you for joining me today. My name is Elizabeth Bayne, and I'll be presenting Analyzing Chocolate Milk, Evidence of Narrative as a Vehicle for Community Building and Change. Many of you may know me as a filmmaker, but I'm also a public health professional. And I designed the documentary, Chocolate Milk, to be a social impact campaign. And in today's presentation, I'll show you how I developed that narrative to have an impact on behavior and also to help mobilize communities around the issue of breastfeeding. Thank you. I hope you enjoy my presentation. At the end of the presentation, participants will be able to define the key narrative elements of a storytelling advocacy campaign, explain how social behavior change models can promote equity and inclusion, and identify effective strategies for reaching target influencers and stakeholders. I've broken this presentation into 5 chapters, starting with an introduction, a chapter on storytelling, social behavior theories, campaign outreach, and social impact. Chapter 1, Introduction. So Chocolate Milk is a multi-year campaign to address the racial disparities in birth and breastfeeding outcomes for Black women in the US. And before I began the campaign, I drafted a positioning statement. And a positioning statement is an internal tool that we use to define our target audience and the desired behavior that we would like them to adopt. And this is commonly used in social marketing. My positioning statement was, we want African Americans to see breastfeeding and breast milk as normal and is more important and beneficial than artificial baby milk. Now, you might be wondering why you don't see the word mothers in that statement, and you'll see in the next section why. The challenge in communicating breastfeeding issues is that we often focus on mothers, but I thought a solution might be that breastfeeding could be a responsibility that's shared with the community, including peers, partners, family, and health providers. So it's not solely placed on the shoulders of mothers. Now, before I began developing the story around that positioning statement and solution, I had to do a little research. And in public health school, one of the things they teach you in community outreach training is that you don't want to start with assumptions. You want to learn a little bit more about the community that you want to target before you just start deciding what to do. And so I began with some formative research, starting with academic research papers, to familiarize myself with the demographic and health data around the issue. After that, I wanted to talk to the people behind those statistics. So I organized informal focus groups with mothers and lactation workers and health providers who worked in the Black breastfeeding community. And following that, I did some field observations in the form of ethnographic interviews. And in this case, I would sit down with mothers in their kitchens, in their living rooms, and talk to them about their breastfeeding journeys. And since I'm a filmmaker, I decided to tape those interviews, and that became Chocolate Milk, the documentary series. And the great thing about doing that is that that became my pilot testing for the use of story and narrative in terms of impacting breastfeeding outcomes for Black moms. And finally, I was able to present these web series episodes at conferences around the country. And what I discovered through that formative research was that, number one, Black women do in fact breastfeed. 2, there is racial bias in the healthcare system that affects their abilities to do so, that there's a lack of racial diversity in the lactation field, and that Black health workers are often undervalued, which can lead to burnout. Finally, I learned that mothers often feel guilty or overburdened when they're unable to successfully meet their breastfeeding goals, and we didn't want that. So I developed a narrative around the documentary, and it goes a little something like this. Chocolate Milk explores racial gaps in birth and breastfeeding outcomes for African American mothers through the stories of 3 Black women living and working in South Central Los Angeles. The film follows a new mother, a midwife, and a WIC lactation educator as they fight to overcome racial inequality in the American maternal healthcare system. Now, you might be wondering how I chose those 3 women to be the focal point of the documentary. The next slide will tell you why. So there are a lot of key elements in storytelling, including the setting, the plot, and the theme. But in today's presentation, I wanted to focus on character and the emotional conflict that creates drama and helps us care. So the character or the protagonist is a main story element because that's what's going to make your film or your storyline relatable or identifiable if the audience can see themselves in the character. The next thing you want to introduce is the goal, the character's goal, and the obstacles that they have to overcome to achieve their goal. And finally, the drama comes when you introduce the stakes. What is it that the character has to lose if they don't achieve their goal? Let's go through each one. Tammy is a new mother, and her goal is to breastfeed for 1 year. The obstacles in her way are her lack of knowledge about breastfeeding and her lack of family history of breastfeeding. Another one is returning to work early. Tammy actually faced several other obstacles, but we'll focus on these. And the stakes for her not achieving her goal of breastfeeding 1 year are guilt, the additional expense of having to buy formula, and also the long and short-term health outcomes or consequences rather for her and her baby. Lydia is a lactation educator, and her goal is to become an IBCLC so that she can better serve her community. The obstacles that Lydia faces are the certification requirements for someone who doesn't already have a college education, and also the additional time and expense of taking those college courses so that she can meet those requirements for certification. The stakes for Lydia, if she doesn't achieve her goal, is that she won't be able to serve the complex cases that present at the WIC center where she works. In addition, when you're able to achieve higher levels of certification, that comes with greater job and income sustainability. And that would be at risk for Lydia if she's not able to accomplish her goal. The third character in the film is Rasha, a third-generation home birth midwife. Rasha's goal is to operate a community birthing center. And the obstacles to her goal are non-paying clients, abuse of the sliding scale that she created for low-income patients, or clients rather, and also racial discrimination, both within the community and also within the community of midwives. And the stakes for Rasha, if she's not able to achieve her goal, are inability to keep her business open and also her personal and family well-being. Now, I've just presented some reasons that I chose Tammy and Lydia and Rasha as characters in my film. I'm going to see what you can remember. So question number 1, what are some reasons that I might have chosen Tammy, Lydia, and Rasha as characters in my film? Select all that apply. A, as Black women, their stories and challenges are relatable. B, Tammy wants to breastfeed but faces various difficulties. C, they counter negative stereotypes about Black mothers. D, Rasha's time is not valued as much as a white midwife's. E, Lydia is not licensed to provide the complex care her clients need. I'll give you a few moments to think about the answer. The answer is all of them, A, B, C, D, and E. And the rationale for that is that Tammy, Lydia, and Rasha are relatable characters who represent various factors that affect Black mothers' ability to sustain breastfeeding. Now, initially, when I developed the project, I thought I was going to follow 3 new moms and see if they could all reach their goals of breastfeeding for 6 months. But as I learned more about the issue and I learned about the plight of health workers in the field, and especially Black lactation workers, I thought I wanted to shed some light on those issues too, so that we as a community could value their services more. And that's why I decided to focus not just on new mothers, but also on a midwife and a lactation worker working with that community. Now, specifically for the individual level, Tammy represents mothers with limited breastfeeding and community support. Lydia represents the lack of diversity among lactation professionals due to educational barriers, and Rasha represents the undervaluing of Black lactation and birth workers, which can often lead to burnout. So, next chapter, social behavior theories. So now I'd like to show you some of the science behind the storytelling and why incorporating them can help enhance the effectiveness of your narrative. So for my primary audience of Black women ages 18 to 34, I have a quote here from Albert Bandura, who is a leader in social marketing. And he says, learning would be exceedingly laborious, not to mention hazardous, if people had to rely solely on the effects of their own actions to inform them what to do. Fortunately, most human behavior is learned observationally through modeling. From observing others, one forms an idea of how new behaviors are performed, and on later occasions, this coded information serves as a guide for action. Now, what Mr. Bandura is trying to say in a very complicated way is that if we had to learn lessons purely based off our own experience, not only would that be very taxing and dangerous, it wouldn't be very time effective, because we would lose a lot of ground in making all of our own mistakes. But we can observe from other people the consequences and the benefits of the actions that they take and learn from that. It's a lot faster, it's a lot more efficient. So, one of the first theories that I incorporated into the narrative for chocolate milk is social learning theory. And that's the idea that human behavior is learned by observing and modeling the behaviors, attitudes, and emotional reactions of others. A second theory is social norms theory. That's the idea that human behavior is influenced by misperceptions of how our peers think and act. So if the misperception is that other Black women don't breastfeed, then maybe I have less motivation to do it. But if I know that other women are maybe having challenges but overcoming them, that might motivate me to push through. A third behavior theory is extended elaboration likelihood model. And that's the idea that entertainment-based interventions can influence attitudes, enhance persuasive effects, and stimulate social reinforcement of healthy behaviors, hence making a film instead of a fact sheet. The secondary audience for the film were health providers, families, and peers. And I'm going to quote myself. One of the concerns that I had is that I noticed that over time, statistics regarding racial disparities in breastfeeding have become misconstrued, with the perception being that Black women don't breastfeed for cultural reasons or due to personal preference, rather than the reality that their choices are largely mitigated by circumstances stemming from systemic effects of racism. And so I noticed that a lot of communication around breastfeeding for Black women didn't identify or acknowledge the cultural differences in their experience. And so individual differences theory is something that addresses that. That states that individuals consume and respond differently to media according to their psychological needs, which may be for information, a sense of belonging, excitement, or escapism. And in this case, we needed health providers and family and peers to recognize that there are cultural differences for breastfeeding mothers, and specifically for Black women, and that to ignore those cultural differences means that you're not really addressing the things that make it more challenging for them to be successful. Second theory is diffusion of innovation theory. And that's the idea that over time, an idea or product gains momentum and diffuses through a specific population or social system. And my idea was that if I can enlist the support of health providers, families, and peers, they can help spread the word instead of it being solely relying on marketing. That these people will become influencers in these women's lives and help shape their thinking around breastfeeding. So I just went over 5 different behavior theories. How might the social and behavior theories that I presented be used in storytelling to help promote equity and inclusion? A, making mothers feel guilty for not breastfeeding. B, correcting the misperception that Black women don't breastfeed. C, demonstrating the need for greater diversity in lactation. D, acknowledging the cultural differences that make breastfeeding challenging. Or E, providing an educational tool for health providers and patients. I'm going to take a few minutes or a few seconds to let you think about those answers. Which one is it? The answers are B, C, D, and E. The rationale. Of course, we don't want women to feel guilty about not being able to reach their breastfeeding goals. We do want them to feel empowered. And so impactful storytelling uses social behavior theories to help audiences identify with the protagonist and observe the benefits or consequences of particular behaviors. Social norms theory corrects the misperception that Black women don't breastfeed by reframing it as an accepted practice and lost tradition that must be supported. Individual differences theory acknowledges the systemic barriers that make breastfeeding challenging for Black mothers. And diffusion of innovation theory allows early adopters such as doulas, midwives, and lactation consultants to use the film as an educational tool to promote breastfeeding and discourage racial bias amongst their peers of health providers. And so you can see that by incorporating these psychological theories into the narrative, we're able to address some of the underlying issues of racism, equity, and inclusion issues into our narrative. Next chapter, campaign outreach. Campaign strategy. So the strategy for chocolate milk started with formative research. And in that process, we developed a following and gained credibility by releasing the web series to the community for free. And this name recognition that the web series gained helped us when we reached out to organizations about hosting the film. And so from February through June 2019, we compiled a list of birth and breastfeeding organizations in every single state. And each email invitation to screen an early cut of chocolate milk was followed up with a one-time phone call and biweekly email reminders. And so there were several key elements in our campaign strategy. There was early engagement, which we just discussed. There's brand identity. So we used branding consistently throughout the life of the web series and also in promoting the film so that people would remember us from the content on YouTube that we've been pushing out in years before. The products that we included with the film were some promotional assets like flyers, photos from the film, brand assets, things that they could do, incorporate into their social media posts. We had social media announcements to remind organizations to sign up and also to encourage people to reach out to local organizations to see if they are hosting an event, and if not, encourage them to do so, and if they were, to RSVP. We also did direct marketing using email newsletters. And then the timing of the film's campaign was very instrumental in our success. We could have had it throughout the year or any time during the year, but we chose August because that's National Breastfeeding Month and Black Breastfeeding Week. That's a time when organizations are already rallying around the issue of breastfeeding and looking for activities to add to their events calendar. Finally, price. We made the film available for free, which is always helpful. And to make sure that people didn't undervalue the product just because it was free, we created some sense of exclusivity by limiting it to the first 200 organizations that registered. Now, how did that strategy work? Was it effective? Yes, it was. We were able to have 200 organizations participate in our screenings, and they hosted 250 screenings across 36 states. Now, in this little infographic, you can see that the majority of the organizations that participated were located in the South, with 88 organizations participating. We also had good representation in the Northwest, the Midwest, and the North, though. The demographics of the population that these organizations served was 98% African American, 82% Hispanic, 63% white, 47% Asian, 24% Native Hawaiian and Pacific Islander, and 27% American Indian or Alaska Native. So we actually did have some Native American organizations, or American Indian organizations rather, participating. So we had the whole BIPOC participating in these screenings, but our main audience were Black women, and they were the ones participating the most. And 90% of the organizations served women aged 18 to 34, so that is part of our key demographic. And also 63% of the organizations served households making less than $35,000 annually. So we did reach our main target audience. We were successful in doing that. Now, which of the following are the key elements of an effective strategy for reaching target influencers and stakeholders? Select all that apply. A, a community-based focus. B, word-of-mouth marketing. C, direct marketing. D, clear and distinct branding. E, free and publicly accessible content, or F, all of the above. Now, I think you can probably tell a trend here. All of my questions are, for the most part, summaries of what you just learned, and usually the answer is going to be everything. So what do you think it is? I'll give you a few moments. The answer is F, all of the above. The reason for that being, when drafting a communication strategy to effectively reach your target audience, and in this case, stakeholders and influencers, because my audience, while my key audience are Black women ages 18 to 34, to get to them, I had to go through organizations. And so my communication strategy was designed around motivating organizations to host the film so that they could then bring it to my target audience of Black women. And so the number one thing to remember is you don't assume you know where audiences get their information. Number two, you don't dismiss small outlets that may have a dedicated following. So while I had relationships with National WIC Association and La Leche League, we actually made an effort to reach out to individual organizations in different states, different coalitions, different support groups. No one was too small. And number three, consider the needs of influencers and stakeholders when offering content to share. Remember that whatever is important and beneficial to their audiences is going to be important and beneficial to them. They'll be happy to share it. And so I created content that directly benefited the community that they served, and thus it was an easy sell. So what was the social impact? So we were able to get organizations to participate in the screenings, but did the film really have any effect? That's a big question. So we did a survey, and that survey was done on mobile phones that audiences could take out, and they would do a pre-screening survey. And then after they watched the film, there was a post-screening survey. And that helped us gauge changes in people's attitudes and ideas and beliefs about breastfeeding. And so what we tracked in terms of impact was previous exposure. This was self-reported, whether or not people had been exposed to messaging about breastfeeding before the film. Parasocial interaction, that's the idea of whether or not audiences bonded with or related to the characters on screen. Audience involvement, how engaged were they with each woman's personal story. Behavior change, these are intended behaviors. Obviously, they can't change their behavior 10 minutes after watching the film, but they can talk about their intentions, what actions they're likely to take, and more likely to take rather, after seeing the film. Efficacy is a measure that we tracked, and that is the idea of how capable did people feel of being able to commit to taking new actions to support breastfeeding mothers. And finally, empowerment. How effective did people feel that they could be at making community level change? And so these were the things we were looking for, and that's how we designed our questionnaire. Now, here are some of the results on the right-hand side. Number one, the film increased Black female respondent knowledge about the connection between birth and breastfeeding by 10%. The barriers to breastfeeding for Black women, like lack of confidence, increased by 21%. Knowledge of the lack of professional support being a barrier for Black women increased by 14.5%. Another thing that increased in terms of respondent knowledge were the keys to an optimal breastfeeding experience. More women, 17.4% more women cited job security, 10.9% more women cited reliable housing, and 9.4% more women responded that help around the house were keys to an optimal breastfeeding experience. Another finding that increased regarding respondent knowledge were the recommendations that someone might make to a mother who's struggling with breastfeeding. Before, the number one recommendation was ask for help, but after watching the film, don't give up became the number one recommendation that increased, and it increased by 17%. Another impact that we had was where breastfeeding mothers can find support. The recommendation of midwife increased by 19.6%, WIC staff increased by 17.4%, and her partner increased by 10.9%. Before this, the number one place where people would recommend mothers go to for support were hospital staff, and that number actually declined. And so now, as a result of watching the film, people identified alternative sources of breastfeeding support, which is great. Another finding or result in the survey was that the film increased the likelihood that respondents would take actions to support breastfeeding mothers, like delivered prepared meals, which increased by 28.2%, and household chores, which increased by 19.5%. That was really exciting for me because a lot of times people don't know how to support a breastfeeding mother. And the idea that by watching the film and watching the experiences of the characters, they were able to learn some things that they could bring into their own lives. That was really fulfilling, really exciting for me. Another finding was that 95% of Black females agreed that the film accurately depicts the lives and experiences of Black mothers. That was also really great to hear because it means that the formative research that I did before I began the film was really effective in helping me find an authentic voice for the project. Another finding was that 80% of Black females stated personally experiencing the issues depicted in the film or knowing someone else who has. That's great. 63% of Black females found Tammy's character and story the most relatable. That's great because that was our primary target audience. The majority of lactation and other health professionals found Lydia's story to be the most relatable. And that's great because that's what Lydia was for. Lydia was there to speak to health providers and to also help them recognize the need for more diversity in their field so that when they do encounter a woman of color who's interested in achieving a higher level in their field, they'll be an ally. So next slide. So now, though what we just discussed were the results of the survey. Now I want to also talk about the results of the campaign. And what we tracked for that was the campaign's ability to reframe the narrative around breastfeeding. We were able to mobilize communities around breastfeeding. We were able to encourage organizations to utilize traditional media like radio, TV, and podcasts to promote their screenings. The campaign also facilitated skills development because in addition to making the film available in flyers and branding assets, we also included tip sheets that had recommendations on how to find a sponsor for your hosting event, how to identify a proper venue, how to partner with other organizations so that you could have joint screenings. And so for organizations that were new to some of these activities, this became a professional development opportunity. In addition, we were able to drum up support from policymakers. We were able to create a national platform around breastfeeding through the film. And also, this was probably one of the most gratifying, is that we inspired the creation of more breastfeeding support groups through the film. And here are some quotes from organizers that participated in hosting screenings in their communities. Michelle C. from Peoria, Illinois said, "We had a great turnout and great discussion that is still continuing months later as a result of this screening. I left feeling energized and motivated to make changes and feel confident that the audience felt the same." Rose H. from Tulsa, Oklahoma said, "I am now hosting monthly breastfeeding talks at the location of the venue. That was so exciting for me to hear." And finally, Patricia G. from Orange County, WIC, she said, "It was great to see the community coming together to watch the screening. The event was very well received. We engaged with midwives, doulas, IBCLC, CLC, and breastfeeding peer counselors, and other nearby health departments. I don't know about you, but that sounds like mobilizing communities." So, in conclusion, I just talked to you about how I was able to take a narrative film and use it to help change ideas and perceptions and intended behavior about how we as a community can support breastfeeding mothers. Now it's your turn. What is an issue that your organization is trying to tackle? How can you center the issue around a story? Is there a personal story that you might have? Is there someone who's a success story in your community that you'd like to focus on? Who would be your protagonist? These are questions that you can start to ask yourself as you craft your narratives. And if you'd like to see the full results of our survey and the social impact report that we produced after the campaign was done, you can see the full report at chocolatemilk.com/press. Again, my name is Elizabeth Bayne, and I am the filmmaker and producer behind Chocolate Milk, the documentary, and really excited to be able to share my work with you all, and I hope that you found it helpful in your own outreach efforts.